Te Mātauranga Māori and Tikanga-Informed care offer a different approach to health and well-being, Toitū Hauora, and remedy some of the ailments of our modern healthcare system. The healthcare system is a massive and complex industry. Not only is it affected by the economy and all aspects of society, but it in turn has an influence on the economy and society itself. Globalization has seen healthcare systems extend beyond domestic and international borders. The global expansion of systems continues, despite the inconvenience of cyber threats on health information technology and the COVID pandemic's impact on the mobilization of the global health workforce. Modern healthcare systems are a union of science and management, but is this a happy and productive marriage? What models have we constructed to understand the complexity of the healthcare system? How do we conceptualize the problems and solutions in the healthcare industry today? Are systems thinking and optimization of health information technology the only ways forward? What value can Mātauranga Māori and tikanga add to the evolution of our current healthcare system? Before we can envision a better future, we need to understand how our current healthcare system came to be. We need to know its whakapapa, its genealogy. The linear march of progress is a key thread in the common Western narrative of healthcare. That story begins with primitive man and their superstitious explanations of illness, evolving to a superior scientific understanding of health and illness. The scientific revolution elevated scientific materialism, and together with industrialization and the creation of institutions like universities and hospitals, they coalesced into the foundations of our modern healthcare system. We now have an institutional framework of healthcare where the state governs formal health institutions. This model of the modern healthcare system under the guidance of government bureaucracies has seen magnificent advances in healthcare technology, science and medicine. Diseases have been eradicated, illnesses cured, quality of life has improved, and it can be argued that the incentive structures of the free market have driven this impressive progress. But no paradigm is without its limitations and weaknesses, and societal changes are exposing the cracks in the modern healthcare system. Increasingly, modern society lives in man-made environments, in the urban jungle, eating food from factories rather than their own gardens. Many aspects of our lifestyle are unhealthy, yet we live longer. Our population is aging, which means the burden of chronic disease is growing. Infrequent visits to the doctor or brief episodes of care are becoming less common. We live in the era of information technology. Society demands access and management of their own health information. People are more mobile and their communities are no longer restricted to localities. Social influences on identity are changing how we see ourselves and are shifting our values and expectations regarding appropriate human interactions. Health and socio-economic inequities are increasingly visible and socially and politically unacceptable. Because of its whakapapa of scientific materialism, the modern healthcare system depends on reductionist approaches, analytic thinking, and a faith in linear Newtonian mechanics, dissecting things into their component parts to understand the mechanics of diseases, the mechanics of the human body, and the mechanics of the healthcare system. But this can also lead to fragmented and highly complicated systems that make communication more challenging and operation costs overbearing. There are unintended consequences of a healthcare system built on scientific materialism, industrialism, and institutional frameworks. The commodification of care, health transactions rather than human interactions, a focus on delivering brief health interventions, and reliance on health metrics that tell us that more surgeries mean better health for our community. Despite the best intentions of our healthcare workforce, its managers and state governance, patients, consumers, service users, or tangata whai te ora, or should I just say people, can experience the healthcare system as dehumanising. An ageing population, chronic disease and global pandemics add to the burden on the modern healthcare system, yet increased demand is not the only threat it faces. The weight of its own complexity, its unsustainable focus on supplying greater volumes of health interventions and synthesizing more effective medications are crushing the health system's capacity to learn, adapt and evolve. A new pill cannot cure society of obesity. A 15-minute consultation cannot identify all that ails someone. Health is not a commodity to be found inside a hospital. Fixing components of a broken system will not rescue it. Lean thinking and improving efficiencies cannot sufficiently lighten the load. The faith in the old healthcare system engineering is failing because healthcare systems are not closed or simple systems. They cannot easily be predicted, nor can outcomes be easily engineered. The kind of linear mechanistic thinking that became so prominent in the healthcare system needs to evolve into something more. No longer can healthcare organisations be viewed as a closed system. No longer can it centre on individuals, ignoring the broader ecology of health and well-being. No longer can its preoccupation with the cost of service delivery distract it from the fact that it is no longer fit for purpose, which threatens its very survival. The advent of quantum physics exposed the errors in classical physics, that wonderful pillar of scientific materialism. Likewise, systems thinking and advances in information technology are seen as the likely successors to today's cumbersome mechanistic healthcare systems. But what of Mātauranga Māori and tikanga? What value could they possibly add to this endeavour of health system transformation? Can looking to our past really help us realise our aspirations for the future? Titiro ki muri, haere atu ki mua. Our past and future are intertwined. Mātauranga Māori is knowledge and ways of knowing derived from tipuna Māori, Māori ancestors. Mātauranga Māori can be viewed as an evolutionary branch in human philosophy and thinking that is distinct from the Western branch that gave rise to scientific materialism and analytic philosophy, the knowledge that forms the foundation of our current healthcare system. That Western branch is more inclined towards propositional knowledge, that is, knowledge of facts and analytic thinking, as well as procedural knowledge or practical knowledge, like the knowledge of how to ride a bike. On the other hand, the Mātauranga Māori branch is more oriented towards procedural knowledge, but also whanaunga and relational thinking, or put another way, an ontology of whanaungatanga, which I'll explain later. To whanaunga is to have a shared experience with a collective of people who examine their own unique perspectives and give this shape by using different forms of Mātauranga Māori, like whakapapa, genealogy, metaphor and narrative, pūrākau, and then set it within a context. The process of whanaunga acknowledges different perspectives and encourages broad interpretations, particularly as metaphors and narratives resist reduction down to singular definitions or universal truths. Whanaunga facilitate participatory and perspectival ways of knowing and helps people find meaning in their lives as they relate their own experiences to archetypal stories, for instance. Whānanga as a way of knowing holds great potential value for our healthcare system. It is inherently inclusive and resistant to reductive and mechanistic thinking, which can inadvertently become dehumanising. While a whānanga may be focused on its kaupapa, its agenda or topic, the outcome of the whānanga cannot be predetermined because of the uniqueness of the whānanga. Even if the same participants were to meet in the same setting, the exact same whānanga can never be repeated. Whānanga is not merely a means of transmitting knowledge, it is a means for the emergence of new knowledge. Whānanga as an approach can be used in family meetings, team meetings, and training and educational settings. It can be used to facilitate restorative approaches to complaints resolutions or the investigations of serious incidents in healthcare as part of a process of hohauro, conflict resolution or peacemaking. The benefit of the use of narrative and storytelling in healthcare is not a new idea. Kōrero pūrākau, our traditional Māori stories, have long been used to help people make sense of their lives, find meaning, purpose, and hauora, health and well-being. Before, I mentioned a relational thinking or an ontology of whanaungatanga. Now this is the Māori version of systems thinking. Māori and other Indigenous people were the original eco-warriors. They were all about sustainable living and systems or ecological thinking before climate change and the ecological crisis, before systems theory was even thought up, and before globalization forced us to consider our interconnectedness. Māori have an ontology of whanaungatanga, meaning everything is connected through ties of kinship, and things can only come into existence through their relationships. When compared to some Western analytic philosophical traditions and science, some critical differences emerge. An ontology of whanaungatanga focuses on kin, not kind. It focuses on relationships and connections, not trying to distinguish things into their categories or dissecting them down into their component parts, reducing them down to their basic constituents. It is very much about taking a broad ecological perspective on existence. Now, what evidence of this kind of thinking do we see in Māori culture? Well, there's the traditional Māori way of introducing yourself by sharing your pepeha. When Māori recite their pepeha and link themselves to their mountains, rivers and the ocean, these are not seen as mere geological markers of local culture. They are seen as relatives, as tipuna, ancestors. A pepeha is not a territorial claim to ownership of the land. It is a genealogical declaration of a familial relationship that necessitates certain considerations and obligations, like the responsibility of kaitiakitanga, stewardship or guardianship of the land by its people, by its descendants. Our whanaunga nourishes and provides for us. We reciprocate and care for our whanaunga, our relative, our provider. An ontology of whanaungatanga combats that casual disregard, objectification and exploitation of our planet and our people. Māori have a number of metaphysical concepts that structure their understanding of the central ontology of whanaungatanga, of the relational nature of existence. Concepts like mana and tapu and noa, mauri, hau and wairua. These concepts are the bedrock of the Māori understanding of existence and of hauora, health and well-being. Tikanga is not merely protocols or rules of engagement. Tikanga are the methods employed to operationalise these Māori concepts, meaning tikanga is the practical face of Mātauranga Māori. Tikanga advances the interests of humanity. If it fails to do that, then it fails as tikanga. This is why tikanga simultaneously must maintain the traditions of Mātauranga Māori while adapting to the ever-changing context of our life as we know it. Māori values like manaakitanga and kotahitanga help translate that Mātauranga Māori theory into tikanga practice. When you combine Mātauranga Māori, including the ontology of whanaungatanga, the process of wānanga, and Māori metaphysics, values and tikanga, you can create novel remedies to some of the ailments of our current healthcare system. One such creation is Tikanga-Informed care. Here are the key features of Tikanga-Informed care. Tikanga-Informed care is a broad approach that focuses on creating the optimal conditions for hauora. It starts with an ecological big picture, that's the ontology of whanaungatanga, and it is grounded in Mātauranga Māori. Tikanga-Informed care upholds Māori values and principles, and it is from Māori for everyone. It aligns with equity and te tiriti or Waitangi obligations. It is dynamic and locally tailored, and it is inherently humanising, strengths-based, trauma-informed, and culturally safe. My ideas on tikanga-informed care are based on my model of Māori philosophy, Te Rau, the weaving universe, which I have outlined in one of my videos. I've also made videos on tikanga-informed care and Mātauranga Māori should you want to learn a little bit of background about tikanga-informed care. Our existing healthcare system has focused on creating medical facilities where health assessments and interventions can be delivered by a workforce that ideally would be sized to meet the local community's healthcare needs. Epidemiological approaches have broadened the remit of the healthcare system and delivered population-based health initiatives. Health interventions are the priority of the healthcare system and not whanaungatanga. Tikanga-informed care focuses on creating the optimal conditions for hauora to emerge, and hauora cannot exist outside of relationships, hence whanaungatanga is critically emphasised in tikanga-informed care. If one tends to the conditions that are most conducive to whanaungatanga, then positive hauora outcomes are more likely. You can still offer clinical interventions like surgery or tikanga-informed interventions like miri and romi, but the overall approach ideally should be tikanga-informed. What are some examples of how the optimal conditions of hauora can be created and whanaungatanga emphasised? Well, let's start in the emergency department of a hospital, for instance. Typically, it's painted a shade of white, a sterile colour for a sterile setting. It's a noisy environment full of beeps and alarms in the din of humanity, and sound reverberates off all the hard surfaces. Patients are herded into cubicles or hallways, and there may be one chair in the cubicle for a single visitor if you are lucky. Meals often consist of white bread sandwiches cut into triangles, and sleep is made difficult because of the bright lights and all the hubbub. Busy, hard-working medical staff ask their patients, "What is the problem?" They efficiently screen for ailments, complete examinations, and offer explanations before requesting tests and filling in forms and prescribing treatment to satisfy the standards of safe, quality care and to expedite the patient's discharge. The standard emergency department does not accommodate whānau. Whānau rooms often are small. Immediately, whānau are excluded from being a part of the potential hauora solutions because their presence is not factored into the design of facilities and they do not feel welcome or wanted. The optimal conditions for hauora and whanaungatanga require spaces that are fit for purpose. It costs money to build new emergency departments, but fortunately, modifications can be made to improve them. Acoustic panels can dampen the noise. A lick of paint, artwork and murals can lift the mood, brighten the space, and prompt meaningful hauora conversations and encourage whanaungatanga. Kai, food, is a rongoa, a healing medicine. In most cultures, food is the conduit for connecting and strengthening relationships. Why not use that rongoa in the emergency department and deliver the most delicious and healthy kai? And even if the facilities are shabby and less than ideal, oftentimes it's the human factor that makes all the difference. The manaakitanga and the whanaungatanga. The effort made to make people feel welcome, empowered, connected and safe. It can start with a smile, the offer of a cup of tea. It can start with the obvious effort one puts into pronouncing a person's name correctly, or the sharing of little personal anecdotes and a little bit of whakapapa to help build the relationship. Hospitals are a place of contrast. The sick gather together with the healthy, the dying with the newborns. It is a place of transitions from mauiwi, illness, to hauora, health and well-being. From tapu, a state that is restricted, to noa, a state that is free from restrictions. Tikanga offers practical guidance to navigate the contrasts and the transitions and the risks that exist in such a dynamic space: clinical risk, cultural risk and spiritual risk. Tikanga-Informed care aims to kia piki ake te Māori, to uplift the Māori, and that's like the glue that binds us together into our very existence and being. It aims to enhance mana and respect and protect people's tapu. If you can do that, you can create safe haumaru spaces. Ke Mātauranga Māori and Tikanga-Informed care offer a different approach to hauora and remedy some of what ails our modern healthcare system. Hea hau whakaaro. What do you think? Ke Mātauranga Māori and Tikanga-Informed care offer a different approach to hauora and remedy some of what ails our modern healthcare system. Hea hau whakaaro. What do you think?